And to start off, can you just explain what a Step Ahead Chattanooga is?
Sure thing. So, we are a nonprofit organization, and our mission is to remove barriers to contraception through education, outreach, and access to free birth control. So, we kind of operate along those three pillars: education, outreach, access to free birth control. And that's because we envision a world where women become pregnant on their own terms, which enables them, their families, and ultimately their whole community to thrive. We serve an 18 county region. So we serve 11 counties in Southeast Tennessee, 5 counties in Georgia, and 2 counties in Alabama.
This might be a tricky answer with the pandemic, but usually how many people do you usually see in your offices every year?
Yeah, so the way we work is a little unique in that I'll kind of explain our three pillars of our mission, and that will kind of help you understand how we deliver services. Um, and then I can also share a little history of our organization too, if that's interesting to you. Um, so outreach is pretty obvious. That's just going out into the community and building trust and awareness about who we are and what we do, and just getting the word out about kind of the other two services that we operate under. Education. So we believe that everyone has a right to knowledge about how their bodies work, and that when they have that information, they're able to make the right decision for themselves. So through our education, we've been around since 2014. We have served over 5,000 people through educational classes. Through outreach, we have facilitated more than 30,000 conversations about contraception access and reproductive health. And for us, the way we count those numbers, it's not just that I handed you a piece of paper or that like you saw a flyer somewhere, but that we were present and available to have a conversation. So that's kind of how we look at our outreach numbers. The access to free birth control confuses people sometimes in that we do not deliver the services directly. So we work with partner clinics throughout our region, medical clinics, medical providers. And so the way it works is that somebody contacts us and they need access to free birth control. And we get a little bit of information from them through an intake line with highly trained volunteers. The only qualifications for our services are that you live or go to school in one of our 18 counties. That's it. We don't care about insurance status. We don't care about income. We don't care about anything else. Just do you live or go to school in one of our 18 counties? And so based on kind of the information and where they are in our region and those sorts of things, we find the best clinic for them. And so we connect them directly to that clinic partner. We literally transfer the line and say, I'm going to connect you to that clinic now. And so then they kind of take over in working with the medical provider to schedule the appointment and to get access to that birth control. And then what happens is they show up to their appointment with that medical provider. They kind of do all the normal things you would do at a consult for contraception. They may do a pap smear, they may do STI testing, a pregnancy test, just some general health assessments. We pay for anything related to that visit that is not covered by other means. So if they have insurance, we will pay any copays or deductibles. If they are uninsured, we will pay for everything related to that visit. So it's totally free. So the question of how many people do we see in our office is a little tricky because we don't actually see people in our office. But we serve for the past few years. We've connected just over 1,000 people with access to free birth control. And over the course of our history since 2014, we have connected over 5,000 people with access to free birth control. So that's kind of where we're sitting. And in addition to that, we mail free condoms. We do other things that help connect people as well.
That's awesome. Yeah. Um, so it doesn't matter about insurance or anything like that, as long as they live in one of these counties or go to the schools, they can talk to you all and they
Yeah.
can get help through you guys.
Yeah, that's right. That's it. Yeah. And there are sometimes people are insured, but they are unable to use their insurance for some reason. Sometimes that's, a person who's in their early 20s, who's still on their parents' insurance, who don't want their parents to know that they're accessing birth control. Sometimes that's a person who is in a domestic violence situation and she doesn't want her partner to know that she is seeking birth control. So there's a variety of reasons why sometimes people who do have insurance are unable to access the contraception method that's right for them. And we're able to assist in that way as well.
Yeah, that's really great. Um, I don't know if you can answer this next question, but I was just wondering, what is the difference between, birth control IUDs and the implants?
Sure. So they are all contraception methods. And when we do education and when we talk to prospective clients or people who have questions, we cover the full range of contraception methods. That goes from abstinence all the way to IUDs. And there's a lot of stuff in between. There's natural family planning methods. There's non-hormonal. There's things like the pill, the patch, the depot shot. Those are short-term methods. And then there are long-term methods like the IUD and implant. So I can definitely kind of walk you through those various categories. So for a long time, we have emphasized, and currently we only cover the expenses for the long-term methods, IUDs and implants. And I'll say all of our work is prevention only focused. We do not cover anything related to emergency contraception. So that's kind of off the table for us. That's beyond our scope of work. So our focus was really on the IUDs and implants. And the reason that is they are the most effective methods. They're 99.9% effective when used correctly, and they last the longest. So for the folks who know that they do not want to get pregnant in the next, 5 to 10 years, that's a great option because you don't have to remember to take a pill every day or to go make an appointment to get your shot or whatever. To change your patch. So it's a great, reliable, effective method if you know that you don't want to get pregnant in the next foreseeable few years. The short-term methods include things like the pill, the patch, the ring, and the depot shot. Those are what we consider short-term methods. We are working to expand to cover those methods because we know that an IUD and implant is not right for everybody. That's not the right option. Maybe you are thinking about getting pregnant in the next couple of years, or maybe there's a medical reason that an IUD or implant is not right for you. So the short-term methods are still very effective when used appropriately and in alignment with their directions. The challenges with those is that you have to remember, right, to take a pill every day or to change your patch once a month or whatever. And so sometimes that is challenging for people in their lives to remember to do that. And then the method is not as effective and it increases the chance of getting pregnant. And then certainly there are some natural methods or sort of just like non-medical methods like condoms, both internal and external condoms, the rhythm method, pull-out method, like those are contraception methods. They are not as effective as the short-term and long-term methods. And then certainly abstinence is 100% effective when it comes to pregnancy. So that's kind of the wide range of prevention contraception methods.
And for those who have never, been on any kind of birth control before, what would be the best option? I've heard it's pills, but what would be the best option?
Yeah, so I'll throw in the caveat that I'm not a medical provider, right? So everyone should connect to a qualified, capable medical provider to find the method that is right for them, because that depends on your own medical history and what's important to you. We see a wide range of folks who, when they are first starting to use contraception, what their comfort level is. I think there are a lot of myths out there about IUDs and implants. I think we've all probably heard horror stories from friends who maybe got one and it was not a great option for them or it didn't work for them. And so I think there are times when somebody is just now deciding to get into a contraception method that they do opt for a short-term method and to see how it goes. And that's totally fine. Like you should be comfortable with the method that you land on. And when you're comfortable, you're more likely to use it and stick with it. So we definitely want people to do whatever is right for them. But a good place to start is just learning about all your options. And then you really can decide what's going to be best for your lifestyle.
Right. And I saw on your website where there are a lot of educational presentations. Can you talk to me a little bit more about these, such as, the ones for teenagers and how someone can get a hold of you guys if they want to watch them or show them to their class or something?
Sure thing. So education is a huge focus for us, because that really isn't at the center of what we believe, is just helping people have access to the information so that they can make the right decision for them when it comes to contraception. So education is a really core component of our mission. And we really can create a wide range of educational programming. I have currently 6 health educators on staff. I have 4 full-time health educators and 2 part-time bilingual health educators as well. Um, and they do presentations throughout our region. Sometimes that's a presentation just that covers the variety of methods. And that's, a focus of our education. Sometimes that's about family planning with couples. Sometimes that's working with churches to talk about contraception methods, and family planning. We work with the faith community quite a bit. And then also we do programming with youth, which is comprehensive, inclusive sex education. And it's all voluntary. It's all after school. It's all, above board in that way. But it's helping fill that gap in knowledge, right? So Tennessee teaches abstinence only in our schools. And we know that kids have questions and sometimes they're looking for the answers on the internet. And we'd rather provide them with a trusted source of accurate information. So we facilitate those. We work with partner agencies who invite us in. Like I said, before we ever engage with the youth on education, their parents are given information about what that is, and they can choose to participate or not. But it helps just fill that gap in knowledge, and puts them in touch with an organization that can help answer questions if and when they arise. We also focus a lot on education for parents and guardians. And so these are really personal conversations, and we know that parents and caregivers often want to have that conversation themselves with the kids in their lives, but they don't know where to start, and they don't know what the information is now, and they don't know what the kids are exposed to. And so we do a whole presentation about how to have tough talks with your kids so that parents feel equipped to facilitate that conversation on their own. And that's a huge part of our educational programming as well. So just like around the whole kind of thing around our education, again, is just making sure people have the information they need to make the right decision for themselves. Yeah.
And you said you had bilingual volunteers who also go out in the community.
Yeah. Yeah. I have 2 health educators who are actually on staff, who are bilingual. And that's excellent. And we're so grateful they're part of our team. And we are currently working on adapting a curriculum that will be predominantly in Spanish and culturally relevant to the Latino community. Knowing that, certainly everyone has a different connection to the healthcare system, a different connection to reproductive health. They have different beliefs and values and feelings. And so just being able to meet people where they are, and give them the information that they need. And again, to remove barriers. And we know language can be a barrier, and cultural relevance can be a barrier to this information. So trying to be mindful of that. And that was really born out of, we had people who speak Spanish calling our appointment line and realizing that that was a barrier we needed to help overcome. So it's a really byproduct of listening to our community, and trying to meet that need. We do have opportunities. The primary way we use volunteers, we do have opportunities for people to volunteer. The primary way we do that is they are the people who staff our appointment line. So they go through a training to man that appointment line. Those are like 4-hour shifts. And they're just, from 9 to 5. We don't run a 24-hour appointment line. So if a volunteer runs a shift from like 9 to noon every Tuesday, and that's their appointment time slot. So we definitely have opportunities for people to get involved. We definitely welcome, of course, donations to support our work. All of our services are at zero cost. to our clients. We don't charge for education. We don't charge for contraception access. We don't charge for anything. So certainly we welcome any financial support to be able to continue delivering those services and to never have to turn a person away who needs access to free contraception. And I think the thing, I don't know if we've talked very much about why we do what we do. I say all the time, like, IUDs and implants don't wake me up in the morning just excited. Like, I'm not like, yay, birth control. That's not what gets me going in the day. It's what is possible when people have access to the birth control method that's right for them. So we hear, of people who are able to finish a college degree or pursue a career opportunity or just focus on their taking care of the family they already have or whatever. It just really gives them the opportunity to live with a high degree of self-determination. And that's really cool to see. And the thing I think, immediately, of course, we think of the benefits to the individual and maybe their immediate family. But there's also this community benefit that when people are able to pursue their education and career goals and those sorts of things, we all benefit from that. And there's a healthcare savings too, right? When somebody does not have an unintended pregnancy. So it benefits the individual greatly, and it also benefits our whole community when people are able to thrive. So yeah, that's why we do what we do. It's not just about birth control.